Hi, this is Aishwarya, psychologist at Sukino. Today I'm going to talk about the role of psychologists in stroke rehabilitation. A stroke is not just a physical condition that affects movement. It can also impact on memory, attention, language, decision making, and emotional well-being. Many stroke survivors experience anxiety, depression, frustration, fear of dependency, and loss of confidence, which can affect their recovery. This is where psychologists play a vital role. We assess cognitive and emotional functioning, providing cognitive rehabilitation to improve thinking skills, help patients manage the emotional distress, developing healthy coping strategies, and motivate them to actively participate in rehabilitation journey. We also support caregivers by helping them understanding and managing emotional and behavioral changes that may occur after stroke. Recovery is not only about regaining physical strength, it's also about rebuilding confidence, independence, and hope. Psychology helps that make journey possible. Happy Indian Psychologist Day. Thank you.
Hi, I'm Nandhini, psychologist from Sukino HSR branch. What if I told you that after a stroke or any neurological condition, the biggest challenge isn't always a physical. Sometimes it's a depression. Some people may happy from outside, but they're silently struggling with hopelessness, sadness, and lack of interest to their daily life activity. This is the common sign of many neurological conditions. This where the psychologist plays vital role to make a difference through their counseling, using some of the coping mechanism and stress management technique, and using the therapies like CBT to help their mood monitoring and increase the quality of their life. These things helps the people to regain their confidence, stress management, and increase the mood monitoring, and it helps the people to reconnect with their daily life activities. Remember, heals the brain also means heals the mind.
Hi, I'm Joel Christy Raphael, psychologist from Sukino Sarjapura. I'll be talking about denial as a defense mechanism, which is used by our mind as a skillful tool when we are unable to face the problem face to face. Here are certain triggers that can cause denial in people, which is a medical diagnosis or a sudden unexpected lifestyle change or any type of abuse when people go through. It acts like a shield to protect us from dealing with difficult emotions. So, it is a short term thing that we can feel happy about and not to face the problems directly. What can I do or what you can do to support your family member facing denial? When you see them refusing certain important conversations, trying to minimize the problem or not even think about the problem, you can try to be more compassionate if it is not an emergency to deal with and slowly point out certain things that they need support from. Because it is a time taken process and we can't rush or forcefully tell them all the facts or help them decide or help them expect them to change immediately after getting to know these. So be compassionate to your loved ones, give them the time to take small changes to accept the new realities. Thank you.
Hi, my name is Vismaya. I am a psychologist at Sukino Electronicity branch. I will be talking about the psychological importance of activities of daily living. When we think of activities of daily living, we often think it as eating, dressing, walking, or bathing. But in psychology, it represents much more than physical independence. They reflect a person's emotional well-being, cognition, confidence, and motivation. Whether it's stroke, depression, dementia, or other neurological conditions, psychologists help the individuals to regain these everyday skills through cognitive rehabilitation, emotional support, caregiver guidance, and behavior modification. Because improving areas isn't just about doing daily tasks, it's about restoring independence and quality of life. Psychology doesn't just help people live longer, it helps them live better.